Good afternoon and welcome to everybody, and a really warm welcome. I do hope you've had a good Christmas. I thank all those that were working over Christmas to make sure that our island functioned and was safe. I wish everybody a happy new year. I'm sure it'll be a new year that we'll enter with some difficulty, but hopefully we'll end with much optimism and look back reflectively on a good year. Now, I know that sadly, many who will be listening or watching this broadcast will have been impacted by the rising numbers of people who were diagnosed with COVID before Christmas and indeed since Christmas. And my thoughts and those of my colleagues have been with you all over the festive period and will continue. I'm pleased to say straight away, without any equivocation or doubt, that we're not here today to announce any new measures or restrictions. We're continuing with what we currently have, and those are in place for the time being. But as you would expect, we'll keep that under regular review. Now, that doesn't mean we'll change them. They're kept under review, and if they need to be changed, they will. But that said, today's briefing is nevertheless an important one, as we always have been, want to be totally upfront with everybody about where we're heading with our efforts to manage the pandemic, where we're likely to be going as we continue dealing with the menace, and it is a menace, that's COVID, and this new wave of Omicron infections, well predicted by Dr. Brink and her team before Christmas. We think it's important for the community to understand that the current challenges that I face, that my colleagues on the CCA face, ably assisted by our senior advisors who we're going to have on the panel today, it really is the A-team and Dr. Brink and Dr. Raby, we seek to balance the need to slow the spread of this new variant across our community with ensuring that any measures that we bring in place or are in place disrupt people's lives as little as possible and are proportionate. And that's a word I'll turn back to in due course, and as minimal as possible. So where are we at the moment? Because we're at a certain stage. The first thing to make clear is that we're very much now into the Omicron wave, and Dr. Brink will speak more about that in due course. It was always going to happen. It may have come just perhaps slightly sooner than was originally anticipated, but it's here. And it's here with a vengeance. In the days leading up to Christmas, we began to see a significant increase in the number of cases, and the small amount of random sampling carried out found some 80 to 90% with this new Omicron variant. We then had a large but expected jump in cases over the long Christmas period, and we anticipate and indeed are experiencing further increases in the days ahead. There is good news in that the number of people in hospital with COVID still remains low, and Dr. Raby will speak more about that. But, and there is a but, we know there is a lag between infection and people needing hospital treatment. So as the number of cases continues to rise, we're expecting more to be in hospital. But Dr. Raby will talk you through that when he speaks shortly. Now, we currently, of course, have a number of measures in place. Some are mandatory, like face masks. Others are strongly advised, like everybody working from home whenever that's possible. Please, please, please take up on these mitigations. Your response today has been truly excellent, and I, on behalf of my colleagues, thank you for that. We've also, where we can, tried to reduce restrictions. As again, I emphasise, we really don't want to disrupt people's lives any more than is absolutely necessary. We reduced the isolation period so that people can leave isolation on day 7 as long as certain criteria are met. Namely, that the person must be symptom free and have negative lateral flow tests on day 6 and day 7. If they do that, then they can be released, and they then pass from day 7 to day 10 into the enhanced passive follow-up procedures, which are pretty gentle, but which still need to be followed. So that's briefly where we currently are. The CCA met yesterday, and it was a long meeting to review the latest data and advice from our senior professionals, before concluding that at this stage, despite the rapidly increasing numbers of COVID cases, we do not believe that it's necessary or proportionate now to introduce further measures. But it's very difficult striking the right balance. And I want to speak frankly about the current circumstances we're all trying to manage during this Omicron wave. I think it's important that the community understand our current thinking. We have various and competing priorities. People have views on one side of the issue or other sides of the issue. But where we ultimately want to go to, but we're still some way from it, is to be able to remove all restrictions and let people live their lives as they did before COVID. Now, I mentioned earlier that we use the word proportionate a lot. Now, that's a legal word, or has a legal context in the meaning of the Civil Contingencies Law, and pervades all our thinking when we make decisions. Quite simply, what we're trying to do is to ensure that everybody is allowed to live their lives without being disrupted, unless it's reasonable and justifiable. Now, all members of the CCA are currently aware and constantly aware that there are a wide range of views within the community, probably now more so than at any other point during the pandemic. And people have different views, as I say, about the right way forward. But we are in this wave. We're still in the early days of this wave, and the numbers are considerable. We know that some of you would like us to reintroduce stricter border controls, and some people even favour a short, sharp circuit breaker style lockdown. We should never and can never say never, but at this stage we have no plans at all to go in that direction. We're trying responsibly to live with this virus, COVID, and while living with it, that means adapting to changing circumstances. We're trying to move forward, and we have to move forward. On the other end of the argument, there are many people who are completely fed up with COVID and the disruption it's caused and continues to cause. We're conscious of that growing voice, and it is a growing voice amongst our community, who want all restrictions lifted with no more mandatory isolation for positive cases. Now, wouldn't we like to be able to do that? Wouldn't Dr. Brink and I and Dr. Raby and all the members of the CCA be able to say, hallelujah, we've reached that point? We haven't. We're still some way from that. Of course, we want to get to the position where we can scrap mandatory isolation for COVID, and we believe, as I say, we will get to that position in the hopefully not too distant future, but we're still some way. Proportionality works both ways. We need to make sure all new restrictions are proportionate, but we also need to make sure that we're proportionate when we relax them. Again, I emphasise we'd like to remove all restrictions, but it would be unwise to do so whilst we're in this Omicron wave of infections. What would we do if all our nurses, all our police officers, all our hospital workers generally, all our teachers were down with COVID because we'd lifted all the restrictions? Our economy, our lifestyle wouldn't be able to function. So we cannot do that. It would be irresponsible to do that just at the moment. So in order to get there, to get to where we want to get, we need to manage the implications of this wave. We have to protect our hospital. We've only got one hospital, and we also have to protect all the other critical services that we all use across the islands of the Bailiwick. And I emphasise this, and I cannot emphasise it enough. Although we've got probably one of the world's best vaccination rates, we need to get as many people boosted as possible. Please, 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 if you haven't got your booster, get it as soon as you can. I really can't stress, if I said it 1,000 times, how important that is. And I'm sure it's something both Drs. Brink and Raby will talk about. I hope that's given at least some clarity over the direction we're heading, whilst also acknowledging that we've got this judgment balance. We've got to slow the spread of this variant while people get boosted, but we've also got an absolute and all-pervading desire to interrupt people's lives as little as possible. But that's got to be balanced with the need to protect the community. As I think it's important for the community to understand where we are, we've got to emphasise that where we are is where we are. We've got this wave that's now upon us. We will be reacting to it, but as I said at the very beginning of my little statement, we've got no current intention to make any more restrictions. That may change. I hope it doesn't, but it may change. Just before I hand over to Dr. Brink, there are two milestones coming up that I want to briefly discuss. This first is New Year's Eve, which is obviously an evening where many people want to celebrate with family and friends. While we haven't introduced any new measures or restrictions, we're asking people to act responsibly and do everything they can to slow the spread of the virus. What that means in practical terms is asking organisers of events or parties to take reasonable steps, like, for example, and they're very basic and they're not difficult, know who's attending your gathering, keep a list of those contacts, ask if they've had a negative lateral flow test before they've attended, and ensure where possible there's good ventilation and spacing. We've produced a helpful checklist for everybody. That's whether you're a business, a party provider or an individual, to use if they're hosting an event. It can be found and downloaded from the homepage of our COVID website. And for those who are attending such events or parties, have a good time, but we're asking you to take reasonable steps, like ensuring that you are lateral flow test negative before you leave home, Don't attend if you're feeling unwell. There'll be another New Year's Eve next year. Wear a face covering in appropriate circumstances. Be aware of everybody's personal space, and don't party hop. Go to one pub, go to one house, go to one establishment. If everybody does these things, we will help and we will slow this wave. The final subject at this stage that I wanted to touch upon is education. Term will begin shortly, and we've been in regular dialogue with colleagues from the Committee for Education, Sport and Culture and their Director of Education. They've been very constructive, they've been very reasonable, and they've been very proactive. The priority is to keep schools running effectively and thus minimise the disruption to our young people's education. With that in mind, Education have taken the very sensible decision to introduce a suite of enhanced measures designed to limit the spread of the virus. This builds on the mitigations that are already in place before Christmas. I understand parents and carers will receive information direct from their children's school tomorrow to explain the measures in more detail, but that staff and parents will be familiar with most of them as they were all largely in place earlier this year. Additionally, all staff and students are asked to ensure they have a negative lateral flow test the day before they return to the education setting and in each of the first 3 days of the term. There will also, it will be announced shortly, details of an increased surveillance testing programme. As I said, parents and carers will receive more on this via their children's school tomorrow, but I know that people are keen to hear things, and quite rightly so, as quickly as possible. Anyway, enough from me. I'll now hand over to Dr. Brink, who will take us through the latest data and our expectations for the day ahead.
Thank you very much, Deputy Fairbrush. And I'm going to start with my usual slides, as I think you all become well familiar. But first of all, I'd like to thank Islanders for the support that we've had over the Christmas period. Again, it's been phenomenal, and I'd particularly like to thank my public health team for the very long hours that all of them have put in over the last few days. Really, I couldn't ask for a better team to work with, so thank you to all of the team. Now, what I'm going to start off by doing is looking at where we are with active cases, and I'm presenting them slightly differently to you now. The reason being is that we've changed our testing profile or testing program, and I'll go into that in a little more detail, but first of all, just a snapshot of where we are. So if you look at the case definitions, they have been modified slightly. So we've got LFT active cases. So these are people that are LFT positive and symptomatic but haven't had a PCR. And we introduced that, as I'm sure you're aware, at 9 a.m. on the 27th of December. And we want to count these cases as well because, of course, they form part of the disease burden on the island. What we've also done with regard to vaccination, we're now differentiating between the primary course of vaccination from those who are boosted, because we know the boosting program confers a lot of additional protective efficacy when it comes to Omicron. So if we start off with our active cases, we've got a total of 1,839 active cases. And of course, most of those are in Guernsey, but we do have a total of 15 active cases in Alderney as well. Now, what is important here is that 705 of those in total have been detected through our LFT symptomatic testing program. So, as I said, we launched that at 9 a.m. on the 27th. People have engaged fantastically with it. So you go on the platform, fill out all the details, get the instructions on what to do. If you don't have computer access, there is the option of phoning the clinical helpline as well. And you can see from the 705 cases that we've recorded, the engagement from Islanders has been really, really good. And so again, we are grateful for that support we're having with this testing strategy change. And I think that's going to be important as we move forward. If we look to the right of the table, looking at the vaccination status, what you will see from that is that about 40% of cases occur in boosted individuals, but the majority of the cases are occurring in either unvaccinated, partially vaccinated, or those who've had a primary course of vaccination. Now, another thing which has been quite striking to us within the team in public health is that people who are boosted are tending to have milder infections than people who have just had the primary course of vaccination, or indeed those who are unvaccinated or partially vaccinated. So we really are seeing the impact of the boosting program on the clinical disease severity, and that's really encouraging. Dr. Raby will talk about the hospital admissions, but we've got 5 hospital admissions, and that accounts for 0.2% of our active cases. So we're seeing that decoupling of hospitalization from the number of active cases, which of course is encouraging as well. So if we go to the next slide, please. So the next slide is slide 2, and that's entitled Omicron Recent Changes. And I thought what I'd just do to start off with, summarize, is what the recent changes have been. So of course, the change we announced on the 27th was a change in our testing profile or testing program for symptomatic people. Now, this was important and it was planned because we were predicting an Omicron wave. It came about a week before we would have preferred it to, but from that point of view, we had to be prepared to change, even if it was over the festive period. And so we changed on the 27th of October, released a press release to inform people that was what we were doing, and of course got immediate and very good engagement from the community. Now, what this does is enables us to free up the whole system so we can manage all of the cases that we get effectively. So once we get to 400-500 cases, and possibly above, we need to have very slick processes to make sure that we get through everyone, we identify the case, we contact trace them, we give them the relevant information. So that really needs to be a very well-oiled procedure. And I'm pleased to say that that platform is working very well and is enabling us to get through a large number of cases very efficiently. The other thing that we introduced just before Christmas was the modification of self-isolation for COVID-19 positive cases. Now, that was important for us because we looked at the evidence and we felt that a day 6 and day 7 lateral flow test, if both of those were negative, that was represented a good safety profile for us. That means essentially that people are out on the morning of day 7, so they're out essentially 4 days early, and that is important and has enabled a lot of people to get together over the Christmas period. Now, that balances shortening the period of isolation, so the proportionality of keeping people in isolation with the safety of the general community. So, of course, we always be asked questions on both of those. Now, we are aware of the new CDC recommendation looking at 5 days of isolation where people get out on day 6 as opposed to our day 7. That is done without testing. At the moment, we're in the middle of an Omicron wave, and it is certainly something that we might look at in the future, but we just feel it's the wrong time to do at the moment in the face of Omicron wave. It also would only shorten the period of isolation by about a day. So if we go to the next slide, please. So the next slide then is entitled slide 3, which is the new positive cases. This then shows our story since we opened the borders in towards the middle of the year, so in July. And what you see moving on to the right-hand side of the graph, you see that increase in cases. Now that was our Delta wave, and our Delta wave came up, and we hit a peak round about the beginning of December and into December. And what we then saw was a decrease in cases. And then on the 9th of December, we detected our first case of Omicron. That was a travel-associated case. So at that stage, we were pivoting our sequencing capacity, which we've developed on Ireland, towards the borders to detect any imported cases. So on the 9th, we detected our first imported case of Omicron. And then move on to the 15th, we then took our sequencing capacity and started sequencing people in the community with particular clinical features. And what we were looking at here is the rapid reinfections, because that was a salient feature that was described in the cases seen in South Africa. On the 15th of December, we detected our first community-associated case of Omicron, and this case had no links to travel whatsoever. So the conclusion from that was that we had evidence of community seeding of Omicron. So what we then did is we then pivoted our sequencing to then look at the scale. And we carried on sequencing 10 random samples a day. So we take 10 randomly selected samples. And then on the 22nd, 23rd, and 24th, we saw that between 80 to 90% of these random samples were indeed Omicron. Now, that told us that we were heading towards an Omicron wave, and indeed we started seeing the ticking up of numbers. As you see within the shaded blue area, you can see the exponential increase of Omicron. Now, as I said before, we know that Omicron is highly transmissible. We expected to see a wave of Omicron infection. We hoped that it would be a week or so later, but in the weekend before Christmas, we saw quite a lot of activity, and there were a couple of super spreading events. So we think that probably, together with the efficient household transmission of Omicron, accelerated things for us. So if we then go to the next slide, which looks at our case attribution over time, so that's slide 4. Now, looking at the case attribution over time is really important because it gives us an idea of what is happening in our community. Now, what you can see in the bottom black line are all our travel-associated cases. Now, as we expected, we saw an increase in those numbers in the December period. A lot of those were detected through our border testing policy, and so that was encouraging. But we haven't, it still remains our least frequent attribution of cases. What you see really increasing, which is encouraging, is the orange, which is our community surveillance program. And we've had a fantastic engagement from Islanders on testing before they're going out. And it's really becoming part of people's routine practice. I'm going out to a crowded area, I'm going to see a vulnerable person, let me take a test before. And you can see in that orange line the increasing number of cases that we're detecting through this community surveillance program. Then you look at the blue line, which is our symptomatics, and our symptomatics have tailed off slightly since the Delta wave. Again, that's to be expected. People tend to be far more mildly symptomatic, but what we see in the green line is the efficacy of our contact tracing program, again, just showing that we're detecting a lot of our cases through that contact tracing. And of course, that is really encouraging. So that's a snapshot of our profile, but understanding and knowing the case attribution is essential because it enables us then to pivot our testing and our mitigations appropriately and in an evidence-based way. So the next slide is slide 5, and that looks at the demographics. So it looks at the age and vaccination status of our active cases. Now, what you see, first of all, if we look at the age of our active cases, if you recall the last press conference, I was talking about large numbers of cases in children and young people, so essentially the 10 to 19-year-old age group. What we've seen over the Christmas period is a pivoting of that, and our most frequent age group of infection is now 20 to 24. But if we look at the band from 20 to 30, that's where we're seeing most of our cases of infection. Now, what we've also done is we divided up the unvaccinated, the primary course only, and the boosted. And as I said, the scientific reason for doing that is looking at how many people are boosted, because we believe that that is our most important protection against Omicron. Now, we see encouraging numbers of people boosted, particularly in the older age group, but we also see people that have only had the primary course of vaccination, and indeed some of them that are unvaccinated. And those people will be more vulnerable to severe infection. What we're seeing in the other age groups is we're seeing that a number of people still have to be boosted, but again, we are encouraged by the number of people coming forward for the boosting, and we just can't underestimate how important that is. We really need people to come forward and be boosted. So that then just shows the age profile together with our current vaccination situation. And if we go to the next slide, which is slide 6, which is our Bailiwick booster meter, and that then looks at the target we have to administer the boosting program. So we have a target of about 51,000 that we want to boost. And what we see now, we boosted a total of 37,126 people. So that's 73% of our target population. And here I must pause again and pay my absolute respects and gratitude to the Community Vaccination Centre and indeed to the primary care practices who helped us over the one weekend. in relation to the number of people that have got boosted. It has really been a phenomenal program, and people have worked incredibly hard to make this a possibility. So encouraging progress with the boosting, but still we want to reach that as close to 100% target as we can. If we go to then the final slide, which is slide 7, and that then looks at both our current situation and our uncertainties. So our current situation, we are in we know that, we've demonstrated that, we've shared that information with all of you. I think the encouraging part is that we are seeing a milder disease in the Bailiwick, and we are seeing that dissociation between hospital admissions and case numbers. And again, Dr. Raby will talk about that in more detail. We do have some uncertainties. So behavioural modifications is Islanders have been really good at looking at how we can modify our behaviours to try and prevent onward spread. Now is really important in the face of a wave that we look at what we do. Have we tested before we go? Are we minding people's personal space? Are we staying at home if we're unwell? Are we trying to meet in well-ventilated areas? So all of these things are so important that we modify our behaviours. Are we wearing our masks? So those behavioural modifications are going to be really important as we move through this wave of Omicron infection. The other thing that we need to, we can't quantify precisely at the moment, is the impact of the booster rollout. So we know that after the booster, there will be a time before that immune system is fully mature in response to the boosting program. So there'll be a bit of a lag, a week or so lag, before people are fully protected, up to 2 weeks post having had the booster. So those are the uncertainties and how that will impact on the number of cases we see. One is in our hands, or in fact both are in our hands, is how we modify our behaviours and what the impact, the number of people taking up the boost and what the impact of that on the Omicron wave will be. So thank you very much, Deputy Fairbrush.
Thank you very much indeed, as usual, Dr. Brigg. Now, given the rising numbers and the sharp increase, or steep increase as Dr. Brigg termed it, I'm going to hand straight over to Dr. Raby, who will be able to update us on the potential impact on our hospitals. Dr. Raby.
Thank you. I'm going to talk about how the hospitals are situated at the moment. I'm going to touch on who we've been seeing in the hospitals with COVID, talk about our staffing status, and I'm going to mention visiting. So let's begin with where we are at the Princess Elizabeth Hospital in Guernsey. At the moment, we've got 5 patients in hospital and with COVID, and 4 of those are in the high dependency intensive care area on Brock Ward. And so those 4 are obviously sick enough to need to be in the high dependency part of the hospital. We had 2 discharges with from the hospital with COVID yesterday who had completed their treatment, and we got 2 admissions. So there is some turnover in our numbers, but currently 5. Now, I know that with case numbers in Alderney being there, that there's some questions about what's the situation at the Mina Memorial Hospital. And the position is, as you, I think Alderney people know, the MMH managed some COVID cases earlier in the year, and the doctors and the teams there have experience of doing it. They have single rooms, they have oxygen supplies, they have the drugs, and can manage in the MMH up to a level. But we also know that if anybody in Alderney needs escalating to higher levels of care, then we have plans to bring them over to the Princess Elizabeth Hospital, as you'd expect. So that's just normal business as normal for Alderney. But we are situated to manage cases if we need to from any patients in Alderney. Who have we been seeing in hospital with COVID in recent months? And I'm going to use the months, the last 3 months, so going back to the 1st of October. And if we look at who's been coming in with COVID, over 40% of our admissions have been unvaccinated patients. So that small group of adults who haven't had vaccinations are producing nearly half of our admissions with COVID. And when we look at who's been the most sick, the ones who've needed to go into high dependency and to intensive care, nearly 2/3 of those who've needed that higher level of treatment have not been vaccinated. So we're seeing, and Dr. Brink's already alluded to the fact that at the moment, our hospital admission rates are low, and this is something that we're really hoping will hold. And it's a feature of Omicron that rates are lower in hospital than with previous waves, which is a good thing. But I think our vaccination status as an island has helped us enormously here, and that's what's keeping us safe at the moment in terms of hospital numbers. Long yourself vaccinated if you haven't had your first 2 doses, and if you've had the first 2, get the booster dose when you can, please. Staffing. As you'd expect, with numbers of Omicron and COVID cases being so high at the moment, it's affecting hospital staff and staff in other healthcare settings as well. And we've seen significant numbers of staff getting COVID and currently being off work. Particularly affected have been our intensive care team, nursing staff, and the emergency department. So really frontline services, and we're grateful to other staff who've been working over and above to assist in those areas. With intensive care also being split between 2 sites, so we've got the hot intensive care, the COVID intensive care unit on Brock Ward, and the normal intensive care unit functioning with non-COVID cases. They're having to manage 2 sites, and that's requiring more staff. And so we're testing that team quite hard. We've had to assist them with theatre staff helping out under the supervision of the intensive care nurses. And of course, that means that some of our planned theatre work that we had hoped to be doing today and tomorrow has had to be cancelled. We understand how upsetting it is for patients to get their operation cancelled, especially close to or on the day of surgery, and we've every sympathy with the people affected in that. But we have had to do this, and we constantly have to keep staffing levels under review. So we're very sorry that we haven't been able to do all the joint replacements, for example, today that we had hoped to do. We keep it under constant review, and we know that this is something that COVID, we've seen in previous waves of COVID, that it has an impact on the planned work and on the elective work, and we see waiting lists going up when this happens. We, of course, continue to prioritize the urgent cases, the cancer cases, that sort of thing, as you'd expect, and we will continue to do that. So constantly under review. Staffing levels are a feature of this high level of Omicron and COVID cases at the moment. Talking about visiting at the hospital sites, and I include the MMH in this, the fact is that we're still allowing visiting, and this is, I think, a reflection of the fact that Guernsey people in the Bailiwick have acted really responsibly. We're asking you, please, to give particular thought if you're coming in to visit at the moment. Do that lateral flow test before you come. Don't come to a hospital to visit anybody if you have the remotest symptoms that might be relevant. And please just continue to be as careful as I know you have been. But this is important for protecting the patients in hospital and also protecting the staff and the services. So we will keep visiting under review. We're not restricting it at the moment, but we are asking people to be especially careful at this time because there's so much COVID out there. So finally, from me, I'm just going to emphasize once again, please get that booster shot, and thank you very much. Back to Deputy Fairbrother.
Thank you, Dr. Baby. And as we're less than 36 hours away from the end of this year, I'd like to thank you and your team and Dr. Brink and her team and all the other people who've kept this Bailiwick alive, really, in the sense we've been able to live pretty decent lives compared with most other places in the last 12 months. I know it goes back really another 10 or 11 months before then. So thank you very much indeed for all your good work, all of you. And that's not just the 2 of you. That is all your staff, all your colleagues. Thank you very much. Media, it's your chance to ask questions. Has anybody got a question? Yes, Jim Delbridge.
Thank you very much, everybody, and happy Christmas to you all. Just a quick question about lateral flow tests. We're hearing national stories about a shortage of getting hold of lateral flow tests. We wondered if there was any news regarding Guernsey and whether we would be affected or are currently being affected in this regard.
Thank you. I'll ask Dr. Brink in a moment, but we've got another delivery due tomorrow, and that there's no reason why that shouldn't be delivered. Is there anything you want to add, Dr. Brink, to that? I mean, it's a very very pertinent question from the journalist.
So we've currently got good supplies of lateral flow tests, but obviously it's something that we will keep under careful review.
Thank you, Jim. Thank you for your question. Matt Fallais from Bailiwick.
Thank you to the three of you for your briefing, and happy Christmas to you. On the face of it, our rate of daily infection and new cases appears comparatively high. I think in the last 3 days, it's 346, 410 and 386, which on a very crude per capita reported in the UK. There may be all sorts of statistical or testing reasons for that, but are you able to paint a picture for us, please, of just how high our rate of daily infections is at the present time compared with elsewhere, please?
Yeah, I think there are 2 points. I'm going to come to the professionals in a moment because I'm the political amateur in that sense in relation to this matter. But it's because we're a small island. We've got such good testing capacity. We've got such a good response from our community. And I'm not sure that in the bigger communities, they've got that buy-in from, as we have from the people of the Bailiwick of Guernsey. But it is high. We are going through the Omicron, and the figures will get no better, I would suggest, in the next week or two. But I don't know. Let's come to the professionals. I'll come to Dr. Raby. Is there anything you want to add?
Our levels are high, as you've said. Dr. Brink will probably put them into context in comparison with the other Crown dependencies and England, Scotland, Wales, and we're higher than those at the moment. So what to say? We are on the rising crest of this Omicron wave, and it's going to fall over us just as it has done in other places, and we're going through that now.
Dr. Brink.
Yeah, so I think what you're going to see is not everyone's wave is going to be synchronized. So not everyone's going to experience the same wave at the same time. So you're going to see this lack of synchronicity as it goes through different areas. And indeed, if you look at the UK data just in England and you go from region to region, you'll see the lack of synchronicity of the response. So I think we're all going to experience waves at different times. For me, a key thing that I always look at is our percentage hospital admissions, because to me, that's so important. So if you look, we have a lower percentage hospital admission than both Jersey and the Isle of Man. So we've got 0.2% of our active cases in hospital. Now that is a key performance indicator for us when we do our risk assessment. So I think it's a combination. I think it's always won't be synchronous. We do have really good testing rates, and I think it's probably a combination of both of those.
Thank you. Helen Bowditch from the press. Helen.
Thank you, Deputy Fairbrush. Just sort of following on from that, even though the hospital admissions are low, some people listening to this might be surprised that no new measures have been announced today, and I know you reflected on that in your speech before. I just wondered, is there a threshold of cases that would be met that would make you think, okay, we do need some new restrictions?
I mean, we would take advice, obviously, from our experts. The main overwhelming factor from our experts' advice is any threat to the hospital. And you've heard at the moment there isn't. There are 5 cases, sadly, for having intensive care, if I can use that phrase. But we've only got 5 cases. Now that figure will go up. We've been advised by our experts that it'll go up. But I don't think, unless Doctors Brink or Raby say otherwise, that if we get to say 3,000 or 2,500, that will be the key factor. I don't know. Dr. Raby, is there anything you want to say in that regard?
Yes, we've constantly had a list of things that we would keep under review that would trigger further escalation in what we ask the public to do. And we keep those under review all the time. One of the key ones is, as you've suggested, hospital admissions, hospital numbers, but also how the hospitals equipped to cope with those numbers, because a number of 10 might be too many if very small teams are badly affected in terms of nursing teams or whatever. So we have to review the staffing as well as the numbers, and we do it all the time, and we update the CCA all the time on where we are. When we need help, we are going to be shouting loudly for help. But at the moment, largely thanks to our booster program, and our vaccination program, as we've said, our levels are low and we are able to cope.
Dr. Brink, anything you want to add?
No, Dr. Ray, we said it all.
Right, who have we got next? Roisin Gorson from Channel. Roisin.
Hi there. This is a question regarding hospitality support. A number of hospitality places, the Friquet, the China Red and the Couture, just to name three, have closed due to rising levels of cases. Is there going to be any support considered for these businesses as they try to bounce back off of what's been a very difficult time?
Well, I mean, that's more a P&R question, I think, rather than a CCA. We have considered it at the P&R, and we will be considering it further. I mean, you're right. I mean, those establishments have closed. I imagine others might close, and it's been a difficult time for that sector and many other sectors over the last month or two. Richard Hall from the BBC. Richard, welcome.
Hello there. Thanks very, very much. Yes, we've had a couple of questions from some of our viewers, and this one is one at the top of my list, actually. And that is, the first is from someone in isolation. They're asking if there's been any consideration of giving people isolating 2 hours outdoor exercise as they are in Jersey.
Dr. Brink.
Thank you. So we think in the face of an Omicron wave of infection during a festive period where people are out and about, it is not a sensible thing for us to do at the moment. So that's our current view. We review it on a regular basis. So we will look at that. Of course, people who are isolating, if they do have outdoor space like a garden, they can, of course, go out into the garden and get some fresh air that way. But what we're asking people to do is just bear with us for the moment whilst we get through this wave of infection. But it is something that we will keep under constant review.
Thank you. Unless it's an old hand, Roisin, I think you've got another question.
Yes, I do. It's about reinfection rates with Omicron. We've heard of a few people that have had as little as 5 weeks between one infection and the second. And is this something that is more prevalent with this particular variant?
Dr. Brink.
Yes, absolutely it is, Roisin, and it's in fact one of the triggers that, if you recall with our sequencing program, we initially were looking at imported cases. Once we knew we were seeing imported cases, we targeted our sequencing onto the what we call epidemiological risk, and we looked at rapid reinfection. We are seeing cases of rapid reinfection with Omicron. Now, again, that's mirrored with what people are seeing worldwide, and it's in fact how we detected community seeding was to pick out cases of rapid reinfection and send those for sequencing. That's something we're seeing, yes.
Matt Fallais.
Yeah, thank you. I'd like to ask you a question about communication, if I may, because you'll be aware that there has been some criticism publicly and politically, not least of all from your predecessor, Deputy Furbrush, about what is claimed by some people to be a vacuum of information since Christmas, or going back perhaps to Christmas Eve. I know that you have always said that you will only hold a briefing when you have something to say and when you think it's useful to speak in this way to the community. But are you able to address the concerns which do appear to have grown in recent days in particular about this claim of a vacuum of information over the past few days, please?
Okay, I'll ask Dr. Brink first, I think, because it will affect upon her staff, and then I'll comment after. Dr. Brink.
I have to say, as a team, we have found this very demoralising. For the first time, we actually felt quite demoralised by this. We were working incredibly long hours over this period of time, and indeed, I think it's unfair, if I may be as bold, to say that there was no communication, because we put out a press release on the 27th, explaining the change of testing policy, and also at that time saying that we were in the face of an Omicron wave and explaining some of the sequencing data that we had. We were working 14, 16-hour days at that time to institute a new program over a bank holiday in the face of what we thought was a progressing wave. And again, we did call it right, because we knew that to make sure that we could smoothly manage all of the cases is we had to change our system of testing, and which is what we did, and it has been extremely effective. But at the time and even now, and I've had several of my team come into my office this morning, and they do find it quite demoralising. So I must be completely honest about that. And may I also be as bold to say quite distracting as well. So we're trying our best to work under difficult circumstances in the face of an infection. We launched a major program on a bank. The right thing to do for the community, and we put out a press release in relation to that. So I'm sorry if I sound a bit downbeat about it, but that's how we feel.
You don't need to apologise at all, Dr. Brink. I, as a politician, would like to apologise to your colleagues and to you for the fact that you've been subject to that criticism. I think it was probably mainly directed at me. But we had a briefing shortly before Christmas. We've got one now just shortly after Christmas. The CCA published guidance just before Christmas. As Matt said, I have said, and I repeat, and I continue to repeat, we'll only have one of these broadcasts when we have something to say. I do wish that people who are in responsible positions would act responsibly and not seek to make political points which are vacuous, unmerited. And I've got to say also, I think the journalists have a degree of responsibility because you give people airtime. I'll go on to the next question now, which is from Helen Bowditch. Helen.
Thank you. On schools, Deputy Fairbrush, you mentioned that your colleagues on Education, Sport and Culture are really keen to see schools reopen on time next Thursday, and you said that there was going to be a suite of advanced measures. Are you allowed to say what those extra measures are going to be?
Yeah, well, I think what I said earlier, and it's, openness is the transparency. That's what we want to be. Education are going to tell the parents, the schools are going to tell the parents and carers tomorrow what those are going to be. And I've no doubt that also, because I just know how much effort that, the educational authorities, by that I mean Director of Education, the teachers, their head teachers, etc., are putting into this, that it will probably vary if things need to be varied between now and the schools opening in just over a week's time. So I'm sorry I can't be more open than what I've already said. The detail I gave when I made my little introduction is the best information I can give at the moment, but that information will be given, as I think it must be, to parents and carers first tomorrow by the Education Authority. Richard Hall.
Hello, thank you. Another one from one of our viewers, actually. With the case, we've got a situation now, obviously, where you've got one of the best take-ups of the vaccine in the world and the boosters. But people are still being put into isolation, and it is affecting business. So what is the exit plan here with 1,800 odd cases now and 5 hospitalizations? When does the priority shift to economic stability?
Well, we've always had, I'm talking about politically now, because we get advice from e.g. Dr. Raby, e.g. Dr. Brink, but our responsibility primarily is the health of the community, but also we have to take into account the economic health of the community. Now, Dr. Brink dealt with this earlier when we reduced relatively recently from 10 to 7 days, and she's made the point in her address, her comments, that the reduction to 5 days actually is only 1 day extra, and she explained the logic of that. As soon as, but not before, the science is there to justify a reduction to 5 days, then that will be made, and we'll get advice from her, and no doubt we'll react upon that advice. But I can assure you it's a very, very fair question, Richard, that we are concerned with the economic well-being of the island, because I mean, somebody mentioned hospitality before, but there are other sectors that have been really greatly affected by COVID, and will continue because the Omicron variant will and this peak will continue into January and possibly beyond. But no, a very good question well asked. I don't see any other questions which surprises. Oh yes, I do. Matt Fallais. Yes, Matt.
Thank you, Peter. I would like to ask a question which extends on the question that Richard just asked, and your answer, if possible, please. Which is that some jurisdictions, notably the United States, I think, have already gone down to 5-day isolation period. So you will be sat round the Civil Contingencies Authority table, taking advice and weighing options. Are you able to tell us whether you have already actively considered whether to bring the isolation period down to 5 days? And are you not concerned that by not doing so, it may be that there are more people out of circulation and in isolation, but relatively unsymptomatic or only with mild disease, than would be the case if you reduce the isolation period, perhaps initially to 5 days and then ultimately ended it altogether. So perhaps you could just give us an indication of how close you are to that in your thinking.
Well, what we don't want to do is reduce it, e.g. to 5 days, and then find that people are out and they're infecting other people, and it makes the situation worse because, as we know, this current variant is so transmissible. We have discussed it. You've heard what Dr. Brink has said, which is the advice she's given us previously. And the USA, I'm probably saying it wrongly because I'm not a virologist or a medical person. The USA have seemingly done it, I think, more for political reasons than for, there doesn't seem to be the justification health-wise for it. But the last thing we want to do is to be conservative. As soon as we can, and we get advice that it is a safe thing to do for the benefit of our very small community of 65,000 people in our islands of this Bailiwick, we will do so, because the last thing we want to do is to keep people in any longer than they need to be. And I mean, I'm sure we will come, excuse me, we will come to a period where there'll be no isolation, but I think that's probably some time off. Is there anything you want to add, Dr. Brink?
No, I think you've summarised it. Thank you.
Thank you. Richard Hall, another question.
Sorry, I could keep going. I know it's been discussed in the past, and this is obviously a political question more than anything, but will the town parking limits be suspended with the work from home advice?
A good question. I haven't actually thought of that. No, it's a good question. Let me ask. It seems sensible to me to do that, but I can't give you an instant answer. But it's a good question.
Okay.
Helena.
Thank you. Seeing as there's time, I just wondered if I could just sort of ask again about hospitality, because you'll be aware that for some businesses, this is a lockdown in all but name, really. And I know you said that P&R is considering business support, but there is a sense that because this is not officially a lockdown, that business support seems to be off the table.
Well, it's a different situation, isn't it? Because with a lockdown, people have got to close. It's difficult. It is a difficult situation. We have to look at it sensibly. I can assure you we are looking at it. I mean, I've got a clear interest because most people know I've got interest in the hospitality sector. That doesn't influence my decision. I take no part of any discussion that P&R may have in relation to the hospitality sector. But those are being considered, and P&R will meet again next week, and this will be considered further. Richard, another question.
Thank you very much. One question that keeps coming to mind actually is, when will fully vaccinated for things like travel mean boosted, especially as other countries are moving that way in January?
Dr. Brink?
Sorry,
could you just repeat that question? I didn't quite get what you were saying.
Yes, of course. I mean, currently, fully vaccinated means 2 doses, but when will that slip into being boosted as well? So, in other words, your pass will say it fully boosted.
Yes, absolutely. So we will align with the UK on this. So we're aligning our vaccination program with the UK. So we'll be aligning that. But I think people will, it will eventually move to requiring boosting as well, because you have got waning immunity. And on top of that, we do know the efficacy of boosting against Omicron. But I don't have a precise date or time for that.
Thank you very much. Anybody else with any other questions? Because I see nobody's flashing up on my screen, so I'm assuming that everybody's had the opportunity to ask their questions. Thank you very much, everybody. Thank you for the media for your participation and your questions, which were perceptive and helpful. My particular thanks to our 2 experts, Dr. Brink and Dr. Raby. But this amateur will be wishing you all a Happy New Year. I'm sure it'll be a better year than we've ended this one, but ever optimistic. We will get through this, because we are living in a remarkable place, and we're so lucky to live in it. Anyway, Happy New Year, everybody, and thank you for participating.